Good afternoon, and welcome to today's nonpartisan virtual briefing on enhanced premium tax credits. I'm Alyson Northrup, a senior policy officer at the Robert Wood Johnson Foundation, a leading national philanthropy dedicated to taking bold leaps to transform health in our lifetime. For the past 50 years, RWJF has been a trusted, nonpartisan source of information on policy to improve health and well-being in the United States. Today, we'll discuss enhanced premium tax credits, or PTCs, and how they impact healthcare affordability in the United States. I'm looking forward to the conversation. Before we dive in, a few programming notes. We'll have plenty of time for Q&A, so feel free to share your questions in the Q&A box throughout the discussion. A recording of today's discussion will be shared with you in a follow-up email, along with resources referenced during today's discussion. Near the end of our time, we'll share a link to a brief survey in the chat, and we appreciate you completing it. With that, I'd like to introduce you to our experts. Pat Kelly is Executive Director of Your Health Idaho, which is Idaho's state health insurance marketplace. Under Pat's leadership, Your Health Idaho has been recognized as one of the nation's leading health insurance exchanges for achieving the highest per capita enrollment rates while maintaining the lowest operating costs of any exchange. I'm excited to have Pat with us today to explain the purpose of enhanced premium tax credits, how they work, and the impact that enhanced PTCs have in Idaho and for millions of people in the US. Theresa Brilli is a longtime volunteer and patient advocate for the American Cancer Society Cancer Action Network in Colorado. She has worked with ACS-CAN for 16 years to advocate for meaningful healthcare coverage and cancer care improvements. Theresa, who goes by Tree, has personally benefited from access to enhanced premium tax credits, and I'm so glad she's with us today to share her story. First, Pat will walk us through an overview of what enhanced premium tax credits are and how people in Idaho and across the US use them to access affordable health insurance. Pat, over to you.
Well, thank you, Alyson. Certainly appreciate being here today. If we can go forward to the I think it's the third slide, please. All right, thank you. And good afternoon, and thank you for making time to meet with us today. As Alyson mentioned, I'm Pat Kelly, the Executive Director and Chief Executive Officer of Your Health Idaho, Idaho's health insurance marketplace. I joined Your Health Idaho as the Director of Finance in 2013 and have been the Executive Director since the summer of 2014. And coincidentally, today is our deadline day for our 12th open enrollment. So a perfect time to talk about exchanges and how Idahoans have really seen significant savings from our enhanced tax credits. We'll take a few minutes to talk about Your Health Idaho and then jump into the tax credits. Your Health Idaho was formed in 2013 by the Idaho legislature. And as you look across the exchange landscape, we are all structured a little bit differently. In fact, there's a saying that still holds true to this day. If you've seen one exchange, you've seen one exchange. Your Health Idaho is a government entity, which means that we were formed by our legislature, but we're not a state agency, nor are we state employees. That means we receive no state or federal money, which means we also have to run Your Health Idaho like a business, making enough money to pay our bills, and we try to save a little bit for our capital investments, which help us serve Idahoans much better. Tax credits are the staple of the marketplace, and here's a short primer on what they are and how they're calculated. Tax credits reduce the cost of the monthly premium for each individual and are based on three primary factors: a consumer's household income and their family size, whether it be a single person, a married couple, or a family. And since costs vary by geographic region, where someone lives also comes into play when calculating tax credits. Enhanced tax credits were implemented in 2021 as part of the American Rescue Plan Act and extended in the Inflation Reduction Act. Enhanced tax credits are based on these same three criteria. and ensure that no one pays more than 8.5% of their household income for a benchmark plan on the marketplace. We like to remind people that tax credits are for tax people, and in other words, you must have taxable income to be eligible for a tax credit. You must also file taxes and reconcile the tax credit amount to ensure you receive the appropriate amount. Not only is this good for consumers, it also helps mitigate the risk of fraud. And if we can go to the next slide. A few years ago, Your Health Idaho performed a market survey to better understand Idahoans' view on health insurance and their perceptions of affordability. To no one's surprise, cost was the #1 driver when consumers consider health insurance. When referring to cost, consumers specifically identified the monthly premium they pay as the primary driver of the purchase decision. Idahoans, like others across the country, know they need health insurance. Sometimes they just don't think they can afford it. Enhanced tax credits turned the affordability dynamic on its head. Consumers still had skin in the game and still needed to have taxable income to qualify, but now Idahoans had greater savings and in turn, more affordability. The impact of the affordability is shown in the graph on the right. This graph looks at Your Health Idaho's enrollment over the last 5 open enrollment periods, which shows a growth of about 60,000 individuals who now have coverage. And that's about a 77% growth rate from 2021 to open enrollment 2025. A few statistics to put the impact of these savings into perspective. First, 9 out of 10 enrollees receive a tax credit. Second, the average net premium, and this is the amount that consumers pay for their monthly premium. That average net premium is $110 per month. Tax credits on average save Idahoans about 75% on their monthly premium. These savings ensure Idahoans can go to work, earn a living, and keep their job as they stay healthier through regular doctor visits and get ahead of illnesses before they become more serious. In fact, Idaho's economy is booming and our unemployment rate remains below 4%. Most important, Idahoans sleep better at night, knowing they have affordable quality health insurance. Enhanced tax credits and the savings they deliver are a huge part of Idahoans' peace of mind. If we can go to the next slide. So we have a few examples here, which I think will help you understand what you might be wondering, which is just how much can Idahoans save? In short, it's significant. On the right-hand side, you can see the savings from 3 different groups of Idahoans. First, an individual. Think about someone early in their career. They're saving over $1,200 per year. They can take that money, make ends meet, pay their student loans, pay rent, and maybe save just a little bit for their future. In the middle of the graph, we have a family of 4. They're living in the suburbs of Boise, saving almost $3,000 per year because of the enhanced tax credits. This allows them to make sure they have necessities, invest in their family, and allow their children to enjoy sports and activities, and maybe even save for their children's future. On the right-hand side of the graph, we're imagining a retired couple. They've worked their entire life and they now are enjoying retirement, and they're saving over $2,000 per year because of the enhanced tax credits. This allows them to enjoy the retirement they worked so hard for without the threat of having to go back to work just to make ends meet and have health insurance before they reach age 65 and qualify for Medicare. These are just 3 examples of the tens of thousands of Idahoans that see savings from these enhanced tax credits. When I was reflecting on things this morning, I see my family and I see my friends in these examples, and I imagine you can too. And with that, I'll turn it back over to Alyson.
Thanks so much, Pat. And it's so helpful to hear the examples from Idaho, and what enhanced premium tax credits mean in that state. And also to know that, as Pat mentioned, premium tax credits look different, depending on, or rather, the marketplaces look different depending on which state in which you live. But some of the commonalities from state to state will be savings in consumers' pockets, where they don't have to be spending as much on health insurance and can use those savings to apply to other costs and needs in their lives. So thank you so much, Pat, for helping us make sense of the technicalities of how the PTCs, enhanced premium tax credits, work.
Welcome.
And yeah, absolutely. And I'll be back to you. I'm sure we'll have questions for you too later. But for now, I'd love to turn to Thersea Brilli. And we will be hearing from Thersea about her firsthand experience using enhanced premium tax credits to be able to afford care. Over to you, Thersea.
Hi, and thank you. My name is Theresa Brilli. I do go by Tree, and I'm from Longmont, Colorado. I'm an ovarian cancer survivor, and I'm also the state lead ambassador for Colorado for the American Cancer Society Cancer Action Network, or ACS-CAN. I've been volunteering for the past 16 years. ACS-CAN advocates for evidence-based public policies to reduce the cancer burden for everyone and is the nonpartisan advocacy affiliate of the American Cancer Society. I was diagnosed with ovarian cancer 17 years ago at the age of 37. At the time, I was self-employed mother of two without insurance. I knew something was wrong for about 4 years before I was diagnosed with ovarian cancer, but each time I went to the doctor about that issue, I was dismissed with explanations I knew weren't right. But without insurance, it was difficult to keep paying for appointments that weren't helping. At one point, I was told I was too young to worry about cancer, and my symptoms were probably related to perimenopause. When it did become clear something was really wrong and I needed help, I went to Planned Parenthood to get a cheap exam. They referred me for an ultrasound at my expense. Luckily, the doctor in Longmont knew that if I was diagnosed at a specific Denver clinic about an hour away, I would get help paying for my surgery through the Women's Wellness Program. And that's Colorado's breast and cervical cancer early detection program. They found a tumor the size of an orange during my ultrasound. I had surgery 2 weeks later to remove it, and I had a complete hysterectomy. When I was diagnosed with ovarian cancer, it was at a time when only 5% of women with ovarian cancer were surviving the disease. I was very lucky that my cancer was caught early and removed before it spread. No one should be alive due to luck. Thanks to the Women's Wellness Program, most of my surgery was covered. Following my surgery, my doctor recommended chemo, but I would have to pay out of pocket. And so I decided to opt out. It was a difficult decision to make, to take chance that surgery would be enough. No one should have to make that decision to go against your doctor's recommendations for cancer treatment because of cost. But there I was. Fortunately for me, surgery turned out to be enough, and I've been cancer-free since that surgery. So yay. After surgery, I needed continued follow-up care to ensure the cancer wasn't coming back. Immediately following my surgery, I struggled with side effects and I didn't have care. So I had to go to ER a few times. For regular follow-up, I often had to drive nearly an hour for care in immense pain post-surgery. I paid out of pocket for the blood test to confirm I was still cancer-free every 2 weeks. Then it went to every month and then every 6 months. The Colorado program supplemented that cost on a sliding scale for me. It is so hard to put into words the mental health impact of just being out of cancer and uninsured. The anxiety with every bump or lump I felt on my body, every cold, anytime I felt off, I was afraid it was the cancer coming back. Without regular care and a physician who knew me and my medical history and could monitor my symptoms with me and assure me I was okay, my anxiety was unbearable, for sure. Ultimately, I had to file for bankruptcy due to all the medical bills I incurred leading up to my diagnosis and after my surgery when my care was no longer covered. This significantly affected my family. My youngest daughter had to come home during her junior year of college because we were no longer eligible to receive federal loans anymore due to bankruptcy. Not being able to access affordable, comprehensive health coverage has significant ripple effects. Not only does it force someone to make impossible decisions when it comes to their care, but it affects every financial decision in a person's life after that. And in my case, it impacts family as well. I'm so proud to say my daughter finally found a great job 10 or so years later after leaving university. She had to gain that work experience, but it finally worked out. Following my recovery, I got a job with benefits. However, I was denied health insurance due to my pre-existing condition. After the Affordable Act was passed, I became eligible and was able to purchase insurance through my employer. I have been self-employed again for the past 10 years, and insurance has been unaffordable for the most of those years. I was on what considered a junk plan from about 2016 to 2021, which is pretty much useless for cancer patients and survivors. Almost nothing I needed was actually covered, including my hormone therapy, which is critical after the surgery I had. When the enhanced premium tax credits were enacted in 2021, I could finally afford and purchase insurance through Marketplace. My current health insurance premium costs about $700 a month through Kaiser, but I receive about $500 in tax credits per month. If the tax credits expire, I will no longer be able to afford my insurance. Credits are life-saving for so many cancer patients and survivors like me. The enhanced tax credits allow me to purchase comprehensive health care and cover things like essential health benefits like doctor visits, prescription drugs, hospitalizations, preventative services, cancer screenings. It caps annual out-of-pocket costs for me. It prohibits plans from denying coverage or charging more based on pre-existing conditions such as my cancer history. As I mentioned, I'm now on hormone replacement therapy. For years, I would have to order my prescriptions through Canada. Thanks to my insurance through the Affordable Care Act Marketplace, I pay $30 per quarter for hormone replacement therapy compared to about $400 a quarter. If I'd lost my health insurance, it would be difficult to afford my prescriptions. If I lost my health insurance, my mental health would also suffer. The anxiety with every cold, cough, every bump, wondering if it's spread, even 16 years later, will be amplified without regular care. I still can't wait to get the blood test every year to confirm that I'm cancer-free. I literally wait for that day, and I'm so excited when it happens. Without insurance, I'd also lose access to aging care, the yoga and massage that help me manage the physical and mental symptoms that come with being a cancer survivor. Without these things, I'd be sacrificing quality of life. So fast forward, I have 2 adult children and a 5-year-old grandson, and I provide care for him 3 days a week in the afternoons, and they are my world. And I want to be there every moment in their lives. My family still worries about me not having care if I were to lose my insurance and how that would affect my physical and mental health. I am the glue that holds together my family, and I will do anything I have to keep being here for them, but I need insurance coverage to do that. Thank you for listening to my story. I really appreciate it.
Tree, thank you for sharing your story. If I could just ask you to go on mute for me. Thank you. Thank you so much for sharing your story. We are so glad that you are here with us today, both to share your story and to be 16 years strong as a survivor and to be such an integral part of your family and their well-being. And I'm personally glad that you have the health coverage that you need today. And I hope that it's able to continue for you in the future and for millions of others. So at this time, we will take questions from the audience. As folks submit any questions they have via the chat, I can start us off with a couple of conversation starting questions for both Pat and Theresa. So Pat, I am going to start with you. And just to continue to ground us in kind of what the EPT's enhanced premium tax credits mean in real life and how they operate, could you walk through with me who is eligible for the enhanced premium tax credits? I know you talked about income and family size and geography, but maybe also the types of jobs that folks might hold, who might access enhanced premium tax credits, who might not have access to employer-sponsored insurance, and how does a consumer find out if they are eligible for the credits?
Well, Alyson, thanks for the question. You may have to hold me accountable, make sure I get all of those questions in here. But really, tax credits or enhanced tax credits are available to anyone who doesn't qualify for Medicaid, Medicare, or another federal health program. So think about something like TRICARE. The other part of it, and new in the last couple of years, is those who have unaffordable employer-sponsored coverage. So those are the primary qualifications in terms of kind of understanding whether you're in that big pool of eligibility. You asked Alyson, how do you find out? What's the easiest way to know what that tax credit might look like, or how much it might be? Your Health Idaho, just like all of the marketplaces across the country, has a tax credit estimator. It's completely anonymous, so you can go onto our website, yourhealthidaho.org, and click on Shop for Plans or Estimate Savings. And what will happen is you enter your where you live, your zip code, you enter your age, and again, what your family looks like, whether you're single, married, or you have kids. And then you estimate your projected income, or what you'll make over the next year, and you click a button and it tells you your savings. You can then choose to shop for plans, and maybe you want to look and see if your doctor's in network, or if you have a particular formulary that would be covered by your plan. And then once you answer those couple of questions, you can browse anonymously. The beauty of it, it is completely anonymous. I know everyone's a little nervous when they put things into forms online, but we, like other marketplaces, don't collect any data when it comes to that. When you're ready, fill out an application, and our system will answer your or calculate your tax credit in just a few seconds once you're done with that application, and then you're ready to go. I would also add, Alyson, the question around employer-sponsored coverage. So many employers across the country invest most of their health insurance premium dollars in their employees. And because of the cost, sometimes they have little to then contribute to their dependents. Our affordability estimator, very similar to that tax credit estimator, will tell you whether you have affordable coverage or not. That's affordability.yourhealthidaho.org. And just a few questions, and it'll help you understand whether you have affordable or unaffordable coverage. If you have unaffordable coverage, you may be eligible for a tax credit. So not sure if I missed a question, Alyson, please hold me to account.
I think you did a great job, Pat, and covered it. And I'll just note that for other states that have a state marketplace, they'll have similar tools, and states that use the federally facilitated marketplace, likewise, CMS will have similar tools that will calculate your premium, your savings, whether your employer-sponsored insurance offering is considered affordable or not. Thank you. I'm going to turn to you, Tree, with a similar question or a different take on that question. I'm wondering if you could tell us a bit more about how you first learned about the enhanced premium tax credit and kind of your journey to becoming covered by premium tax credits.
I actually learned about it because I volunteer with the American Cancer Society Cancer Action Network, and we were advocating for that. I had originally been around when we advocated for the Affordable Care Act. So that felt good once that passed and I was able to get insurance. So I found out about it. I went online and I decided to use a broker, which in the state of Colorado, they pay for that broker. So I didn't have to pay for it. And there was so much to compare, so much to think about. I just called that broker, and this is the third year now she's helped me re-enroll. So she'll send comparisons to me. She does all the background work. I just get the email saying you're enrolled. So it's been a game changer for sure.
That's great. I'm glad to hear. It sounds like it was a relatively straightforward process for you. That's reassuring.
It was.
Yeah. So a question from the audience. Only 20% of our health is determined by the healthcare we receive. How do premium tax credits or enhanced premium tax credits address health and social needs? Pat, I don't know if you want to take this one. I can start us off just by saying, I think there are many elements that contribute to whether we each have good health and well-being. Pat and Tree both spoke about the reassurance of having healthcare coverage, and all of us will become ill at one point in our lives, need healthcare at some point in our lives. It's often when we least expect it or certainly don't want it. But having the reassurance of healthcare coverage, even if it is just one element of what contributes to good health and well-being. Certainly for the audience member who submitted this question, you're right. There are so many other things that we need as individuals, as a society, to contribute to our good health and well-being, and other federal programs, state programs, good jobs, right? The communities that we live in, that we all need and rely on. So certainly point taken, and that health insurance is one foundational aspect of how we meet all of our health and social needs. Let's see, turning to another audience question. Okay, this one is for Pat. How, and I think you touched on this a bit in your slides, but wondering how enhanced premium tax credits affected enrollment in the marketplaces in Idaho, and perhaps bringing in some of what you've heard from your peers in other states, what you've heard from those colleagues who operate marketplaces in other states about what the enhanced premium tax credits have meant for the marketplaces.
Thanks, Alyson. So there's a lot of different ways to think about the impact. I love that you touched on in the prior question about the peace of mind that comes with health insurance. I think one of the most dramatic elements of the enhanced tax credits is what we call in-year retention. And that means how many people in January maintain that coverage through to the end of the year. We've seen some of the highest in-year retention since the passage of the enhanced tax credits. That's really about savings for individuals. We see about 80% of our January 1 enrollments last through the end of the year. I think that's comparable to other states, although I don't like to speak for other states' metrics. The only way that's, well, I shouldn't say the only way, the enhanced tax credits deliver savings, so individuals don't have to choose between buying groceries, right, and having health insurance. And that's really the power of that. I would also say that enabling people to be able to come on, afford health insurance for a couple of months while they're in between jobs is another part of that. And generally speaking, coverage on the exchange is more affordable than COBRA coverage. And it's very comprehensive, helps bridge those people from one job to the next. I hope that addresses the question. In terms of enrollment growth, 77% over the last 30 open enrollments. I think any business in the country would love to see those numbers. We're proud of the difference we're making in those Idahoans' lives because of the savings with enhanced tax credits.
And I think if folks could just imagine tree, like that is one story among millions of what having access to affordable healthcare coverage can mean in one life. And then the ripple effects, as we've heard in Tree's story about the impacts on her children, her grandchild, who she's able to care for. Tree, I just want to share some incoming comments. They're not questions, but they're gratitude for you being here and sharing your story. Tree's story is amazing and glad she is here. I can't imagine having cancer or potentially fatal disease and not having affordable and accessible health insurance. So just thank you from others in the Zoom room who are appreciating your story. A question that I need to be a little sensitive about. RWJF is a private foundation and we cannot discuss pending legislation, but I do think that we can talk about these enhanced premium tax credits do have an expiration. And there was a question in the chat, what are the timelines for the expiration of the enhanced premium tax credits? And Pat, I'm wondering if I can turn to you for like a delicate dance around not talking about legislation, but talking about kind of the trajectory of these tax credit, enhanced premium tax credits.
Sure, it's a good question, Alyson. So as with most things in life, timing is everything. These enhanced tax credits are set to sunset at the end of calendar year 2025. I hope that answers that question.
Yes. And could you talk a bit about, this is for me, and I'm curious about this, for your business, for Your Health Idaho, like what does that mean for like when you are communicating with folks who are considering coverage? Like, can you kind of back up the timeline a bit for your process over the next year for communicating about premiums?
Happy to, Alyson. So we began direct communications with our consumers in October. And with most businesses, we operate under the current set of rules and regulations. So in October of 2025, we would start to communicate to our consumers their new premiums. Most important to consumers, that net premium that I talked about, which is how much they pay for their coverage, and what that means for 2026. There's a lot of work that goes on in the kind of the health insurance ecosystem. Each state's a little bit different, but if we are communicating with our consumers around 2026, it begins in October of 2025.
And just so I'm understanding, you communicate what current law would be. So you would assume with that the enhanced premium tax credits would go away. Like that's what you would communicate about what the premiums would be in October 2025. Am I understanding that right?
Yeah, Alyson, thanks for clarifying. Yes, is the short answer. So we would communicate new premiums, we would communicate new net premiums, and on average, they would be roughly double what they are today.
Okay, thank you. I have a question that came in for Tree. Tree, well, first, let me just say, another anonymous attendee said, Tree, thank you for your courage to tell your story. And then a question, can you speak to what life looks like with the savings you see from the enhanced premium tax credits? And how do you, this is kind of personal, but like, how do you spend the savings? Like, what is that? Both, it obviously enables you to have access to healthcare coverage, but like those dollars that would have or could have gone to health coverage, what does that free you up to spend your money on? And I'm a little worried Tree may have frozen just as
No, you froze.
Oh,
I'm back now.
okay, great.
So currently, so I'm a real estate broker. I have been for 20 years. I did take a break after cancer so I could try and get insurance and have steady work. I'm also a tax professional. So the ebb and flow of my work is crazy. Sometimes there's money and sometimes there's not. So I have to save every penny. I own a house. So a lot of that money, gets to go into upgrades without me having to forego paying a bill. I get to put away money in savings. I get to have a checking account and a savings, which I did not have before this. It was very low. I also have a car, which is expensive because I'm a real estate agent. I have a lot of expenses. So I think also that the other thing is I get to spoil my grandchild a little bit. I get to take him shopping. I get to help buy him clothes, just necessities, nothing even crazy, but it's the little things that matter. It's the, hey, Gemma, can we go get ice cream? Sure. And there's been times that I just didn't have the cash and I'd have to save the money for, I have to have a colonoscopy, or there was, the mammogram every year. Also things come up like I had a lump in my head and thankfully I had Kaiser and it wasn't cancerous, but they removed it for me. And I can imagine going through that and having to pay out of pocket. That would put a stop on anything extra pretty much. So.
Great, thank you so much. Something that came in for Pat, another technical question. Wondering if you can talk about when premium rates are submitted and set. I feel like I asked a version of this question, but what are the implications of once they are set on premium costs? I think probably most people, self-included, on this Zoom are not insurance experts and like what that looks like kind of behind the scenes. So just hoping you can, the specific question is when are premium rates submitted and set, and then what are the implications for once they're set on premium costs?
Alyson, good question again. I would preface this by saying, our Department of Insurance here in Idaho regulates that part of the market. They do all of the premium review. And I would also say that every state has a little bit different timeline. I think it's safe to say that insurance companies are already working on 2026 rate analysis and trying to understand what their experience looks like and what those premiums would be really a year from now. Rates in Idaho, preliminary rates are available publicly, usually in July, which means that they've been working on them for months prior to that. And then they do go final in October. And I would just follow up on or circle back on the question previously. Really, October is pretty late in the game. If we start communicating under the rules and regulations today, we will lose customers, and then it becomes exponentially more expensive to reacquire those customers. Adding uncertainty and cost into the market for any business is never good. So the timeline seems short, but it's already, or the timeline seems long, but the work is already going for 2026.
That's very helpful. Thank you. I feel like I need to learn this multiple times for it to stick. So I'm glad people like you exist to walk us through it. A question that came in from an audience member for Tree is, and we probably have time for just about 2 more questions. Do community or nonprofit efforts such as Texas 4000, which is an organization that bikes 4,000 miles to fundraise for research, make a difference in the life of a cancer patient by showing support for the fight? Or is that factor very insignificant compared to the other realities of the situation? So Tree, you don't have to represent all cancer patients, but just your perspective would be welcome.
Yeah, I think we all deal with cancer differently. Some of us want to celebrate, some of us want to fight back. I wanted to fight back. So I don't usually do the relays or the rides. That's just not for me. It's very emotional, and it's there to support so many people because that's where they're at in their journey. They want people rallying around them. They need that. For me, I wanted to make a difference and, discuss with my lawmakers meaningful healthcare reform, and change and just how it affects my life. Just me, not, and how it affects my community, of course, because I'm in Longmont and Colorado, and I, talk to people about my journey, and I've actually successfully gotten 3 people to the marketplace that have gotten insurance that didn't know about it. So I think every way is helpful. It all goes into a coffer somewhere that helps, whether it helps support a WIG program, or it helps support rides to chemo, or in the bigger picture, it supports sending me to Washington, to discuss discuss stuff with legislators. It just depends how you feel.
Thank you so much. And I appreciate your not wanting to say legislation. We can talk about legislation in very vague terms. So the final question, I'm actually going to field this one. So Tree and Pat, you can take a breather. A question from the audience: what resources are available to congressional staff to help educate constituents? Well, actually, Tree and Pat, if you want to chime in, you're welcome to. Available to congressional staff to help educate constituents about what enhanced premium tax credits are and how they can go about exploring potential eligibility to receive the credit. So I know Pat mentioned some resources in Idaho. Tree, I don't know if there are ones that you would recommend to congressional staff in Colorado. Feel free to come off mute if that's the case. Go ahead.
Yeah, there's actually, I think the marketplace is just a really good place to start. And the American Cancer Society Cancer Action Network often is there for congressional staff to talk to about resources. We always, after we talk about our wants, we always say, even if we agree or not agree, we're here to give you resources. We're here to point you in the right direction. So that, I think, people having that on their own website or a link to the marketplace just to say, and here's the info. And like I said, in Colorado, the brokers are really helpful. People maybe seem a little hesitant to contact somebody, but it really takes the scariness out of it. It streamlines it. So there's lots of resources, and I didn't even know about it. So we do have a lot more to do to get it out there and to people so they know about it.
That's great. And one thing that I can promise, so everyone who registered for this webinar will receive a follow-up email, and we're planning to include lots of resources that talk about who's covered, currently by enhanced premium tax credits and how some of the information that you've heard today. One thing that we can include in that follow-up note is links to resources that could be good for constituents, right? So where constituents might be able to learn more in your state, in your district. So we can be sure to include that as part of our follow-up note as well. All right. So we are coming to a close of our session. I want to extend first a huge thank you to Pat and Tree for sharing their insights, their stories, their experience. I want to thank all of you for participating in this discussion. I know this is an incredibly hectic time of year for all of us, but especially for congressional staff as you're trying to wrap up the end of a Congress, the end of a year, encourage your bosses to get out of town. So we appreciate your time and interest in this topic. It's wonky and you're diving in, and we love you for it. So we have put a link in the chat for a brief anonymous survey. We would value you completing it. It helps us to plan future events, best meet your needs. We'll provide a recording of this webinar and the link to the survey, along with resources, as I mentioned. And that is it for us. Thank you so much for joining us, and have a great rest of your day.